Okay, so this question, very, very solid for pathology for step 1 and for internal medicine for step 2, okay? We're going to cut to the chase here. Very good factoid for you guys, okay? Before we get started, please subscribe to my channel. I really appreciate it. Give the video a thumbs up, really appreciate it. And find me on Instagram at melman_medical, MEHLMAN_medical, link is down below. And find us on Telegram. Recently created a Telegram group and channel, links are down below. Now, starting the question here, we have a 54-year-old dude. He has a 2-month history of intermittent hematuria and fever. He's had a 5 kilo or 11-pound weight loss during this time. His PSA and his prostate exam are within normal limits. He has hypercalcemia at 11.2 milligrams per deciliter. Normal range is 8.4 to 10.2. He's 2+ urine blood on dipstick. Questions merely asking which of the following is most likely diagnosis. Now look, we could spend 19 minutes talking about every little detail with these answer choices here, but I'm going to stay targeted and concise, okay? Choice A, diabetic glomerulosclerosis, wrong fucking answer. You know immediately this is wrong because diabetic glomerulonephropathy / glomerulosclerosis is a nephrotic syndrome, not a nephritic syndrome. We do not have blood in the urine classically with diabetes, okay? There's a lot we can talk about. Hyperfiltration is the first change that occurs in the kidney with diabetes. You're gonna get non-enzymatic glycosylation of the glomerular basement membrane, which is gonna cause dysfunction of the size and charge barrier, causing albumin to leak through. It's a nephrotic syndrome, okay? Of course, you can get hyaline arteriolosclerosis in the afferent arterioles. You can get chymosteel Wilson nodules as well, which are also hyaline. They're pink circles when you do a biopsy. Wrong fucking answer in this case. Choice B, Goodpasture syndrome, also wrong answer. This is going to be 2, 3, 4. 2, 3, 4. The good pasture is walking in the field. 2, 3, 4. You're probably wondering what the fuck I'm talking about. Type 2 hypersensitivity against the alpha-3 chains of type 4 collagen. Okay, so you have antibodies against collagen 4. Okay, so, or anti-GBM antibodies. Okay, this is Goodpasture syndrome. You say, well, why is that necessarily wrong? I mean, can't that cause hematuria? Yeah, but it's also, it's also going to cause hemoptysis. Okay, so they will give you a guy, he is in the proper age range. Sorry, my voice is fucking dry, but you know what? I'm not going to restart the whole video right now. So they'd give you a guy, let's say 20s to 40s for Goodpasture, who'd have hematuria and hemoptysis. Okay, we don't have hemoptysis here. So we're going to keep looking at the other answers, let alone the fact we wouldn't have hypercalcemia in Goodpasture. Choice C, granulomatosis with polyangiitis. This is the same thing as Wegener. You need to take your fucking training wheels off, okay? Not all questions are going to have Wegener in parentheses. And on the USMLE feedback I've received from students is that Wegener has shown up as just polyangiitis. That's it, okay? So, but Wegener will give you C-ANCA positivity or antiproteinase 3 positivity. That's going to be hematuria plus hemoptysis plus headitis, colloquially, which is any issue with the head, such as otitis, mastoiditis, sinusitis, okay, nasal septal perforation. You're going to get a headitis finding, quote unquote, with hematuria and hemoptysis. Wrong answer in this case. There's more we can talk about, but I'm just going to move forward. Lupus nephritis, wrong fucking answer. Okay, so there's no reason to suspect lupus here. Okay, it's going to be a patient, usually a female. Of course, it doesn't have to be, but it'd be a woman, generally 30s, 40s, who has arthritis. And Malarash is too easy. They can tell you thrombocytopenia. They can tell you a mouth ulcer. They like mucositis with lupus, skin lesions for discoid lupus. But you can get a nephritic picture, absolutely, for lupus nephritis. It's just not the most likely diagnosis here, let alone the fact we wouldn't have hypercalcemia, okay? Choice E, renal cell carcinoma, is our correct answer. So you say, why the hypercalcemia? Now, there's 2 points I want to make. The first is, if we have metastatic cancer, which is possible in this patient because he has B symptoms, he's got a fever, okay? And so fever, night sweats, weight loss, those are B symptoms, which are non-specific for various malignancies. He's also had weight loss, okay? So the cancer could be fairly advanced. So with metastases, we can get hypercalcemia. That's the first point. The second point is, you can also get PTHrP secretion with renal cell carcinoma. That's really important because you say, wait, really? I thought that was squamous cell carcinoma of the lung. It is. but it can also be renal cell carcinoma. That's high yield, and that's very underrated, that detail. Most resources don't mention that, okay? So PTHRP causing hypercalcemia and renal cell carcinoma, even if you don't have METs. And you can also get EPO secretion causing polycythemia, okay? So they can give you increased hematocrit. And yes, that'll present as hematuria. Often flank pain, okay, which I didn't mention here. Flank pain and smoking is the most important risk factor for RCC. Final answer, urinary tract infection, wrong. This is wrong because there's no reason to suspect that. The fever is a little bit of a distractor. It's like, ooh, wow, doesn't explain the hypercalcemia. Urinary tract infections in men are rare unless there's an anatomic issue. I mean, if you had an older man, okay, like 70s and older with BPH, and you have post-renal obstruction, that can be a big risk factor for urinary tract infection, okay, where you get stasis within the bladder, you can get a cystitis. That's where we might see a UTI in an older man, okay, E. coli, usually in that case. As I prefaced with, we're not going to make this a 19-minute clip. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.